I'm sure you will enjoy a very good panel that we have today. And as I say, my name is Maria Neira, and I am the director of the Department of Environment, Climate Change and Health at the World Health Organization. And it is my great pleasure to welcome you to this UN Energy high-level event. As you know, yesterday we have finally our big day on health, but the energy, they have been having a UN day, and it's a pleasure that now even health will be accompanied. This event is co-sponsored by WHO and UNOPS, and in collaboration with all our friends, FAO, OHCI Chair, UNFPA, UNICEF, UNDP, and I hope I'm not missing anyone, but it's the big UN family. And to start the meeting and to join and putting and setting a little bit the scene, it is my pleasure to introduce a video message by Dr. Tedros, the WHO director. Thank you.
UN Special Rapporteur David Boyd, UNOPS Executive Director Jorge Moreira da Silva, UN Special Rapporteur David Boyd, Honorable Ministers, dear colleagues and friends. Human health depends on the health of our planet, and the impact of climate change and health is not a further threat. It's here and now. Health workers and facilities are the forefront of the climate crisis, dealing with the impact of heat waves, the spread of infectious diseases, air pollution, and extreme weather events. But while the health sector is affected by climate change, it also contributes to it, with about 5% of global greenhouse emissions. Shifting to low-carbon health facilities powered by renewable energy will make a significant contribution to climate change mitigation. WHO is committed to supporting countries to build climate-resilient and climate-friendly health systems through the Alliance for Transformative Action on Climate and Health, ATACH. Chaired by the UK, Egypt, and UAE, and hosted by WHO, ATACH unites over 75 countries and 40 partners to share knowledge, provide technical support, and access funding. ATACH plays a key role in integrating climate change and health in national, regional, and global adaptation plans. I thank UNOPS for its partnership with WHO in promoting health systems that protect both planet and people. I thank you.
Thank you very much, and happy ATACH Day. Yesterday was the Health Day. Today is the day of ATACH, so you are all welcome. After the panel, you should be aware that there will be a session of Q&A, and microphones will be distributed. Correct, Luis? Thank you. So you will have an opportunity. But let me now move on. We have Dr. Tedros, so let me now have the other co-host, and it's a great pleasure to introduce Senor Jorge Moreira da Silva, who is the Executive Director of UNOPS. Thank you, Jorge. You have the floor.
Thank you, Maria. Obrigado, Maria. It's a great pleasure to join forces with Dr. Tedros and with WHO and with so many organizations today in this event. Have I had the chance to mention, and I would like to, of course, to welcome and to thank the ministers and the special rapporteur for joining today's session. I had the chance to be at the COPs since I was 28. So I hope that one day they will give me a medal or something. So since 99, I attended almost all COPs. But this is really the first COP that brings health to the center. And I think that this can be really a game changer to the boost that we need on fast pacing. I've been working on environment and climate for so many years, being a parliamentarian, a minister in Portugal, and I know that even if the health of the planet is what drives the ministers of environment, when the health of the people is being brought to the equation, it's when we really get the boost. We saw it on the policies regarding waste management, water, sanitation. We saw it on the policies regarding air quality, the issues on the endocrine disruptors. We saw it on the plastics. We saw it on the BSC and how it changed the food systems. So now that there is a better perception, as my dear friend Tedros shared, about the impacts of climate on health, it's where I think that we will get a boost. So I think that we shouldn't overlook the high potential of bringing health to the center of the climate discussions. We know that the health of human beings and the health of the planet are deeply intertwined. But we also know that the resilience of the health systems regarding climate must be compounded with the resilience that health systems face when it comes to conflict. Because unfortunately there is a correlation, or at least some coincidence of impacts on the resilience of the health systems regarding conflict, fragility, and climate. At the same time, the health systems need to reduce their own emissions, not only adapt, being more resilient to the other shocks, but also contribute to the decarbonization. And that's why we are very glad to be member of the Alliance for Transformative Action on Climate and Health. And with our focus on operations, we are an agency only focused on operation and implementation. I think that we have much to offer by way of practical solutions. Let me be very concrete, and I'll be short, I promise, but just 3 or 4 examples when it comes to building resilience on health systems. Building resilience on health infrastructure, on health procurement, but also on project management. We have been the principal recipient of the Global Fund in Asia for 11 years, and we are at the verge of eliminating malaria. But we must ensure that these gains are not lost despite the impact of climate change on malaria transmission, which we know is shifting, and WHO knows this much better than us. We have been working in some countries for over 20 years, so we understand the context, and we have been a proud and trusted implementation partner. Few examples: in rural Sierra Leone, with the support of the UK and in a close partnership with the government, we have provided access to clean energy by solarizing over 20 health centers. At the same time as with the mini grids, we provided electricity to the schools and local shops. In Yemen, with KfW and World Bank, we built their capacities. We supported their capacities, again on solar energy in health facilities, schools, and homes. In Somalia, and we have the minister here with us, with the bank, we rehabilitated regional hospitals to ensure they can withstand climate-related challenges, and it integrates climate-resilient measures such as flood prevention, wind-resistant structures, and passive cooling systems. And finally, in Sri Lanka, with you, and we constructed a wastewater treatment facility at the provided the installation of a hybrid need. At the same time, it's important to highlight the relevance of solar energy, not only to decarbonize, but also to increase the resilience when it comes to security. So finally, I would like to highlight that we will be very glad in continuing partner with all the organizations here on renewable energy, on sustainable waste management, on sustainable procurement, focusing in an area that is not non-programmatic. WHO knows everything about what comes to health. We are operations. So we are very glad to partner with the governments and with agencies that have a programmatic role, we are operations. We get things done, and we are here to partner with other agencies and with other governments, and I hope that this conversation today will inspire change. Thank you.
Obrigada, Jorge. I think it was very inspiring and very strong messages. My great pleasure now to invite another extremely inspiring person, Mr. David Boyd. He's the UN Special Rapporteur, and I'm sure he will give you with very strong messages. David.
Great clarity that the climate crisis is also a health crisis, and it's also a human rights crisis by the combustion of fossil fuels and the air pollution that results. Hundreds of thousands of premature deaths because of exposure to extreme heat. The increasing spread of vectors, not only to dengue and others. Increasing food insecurity that has reversed the progress towards ending hunger. Increasing water scarcity. And a particular concern of mine is the mental health crisis among young people. A study of 10,000 young people carried out by researchers several years ago found that the majority of them believe there is no hope for humanity. 40% of those 10,000 young people don't even want to have children because of the climate crisis they face. And so I think it's really important when we're here in an air-conditioned room in a very wealthy nation to remember the struggles of the billions of people for whom the climate crisis is an existential crisis. In my role as the UN Special Rapporteur, I've had the privilege to travel across the world. I went to Fiji and visited Vunidogoloa, one of the first communities in the world that had to be completely relocated because of climate change. Their idyllic oceanfront home was the subject of rising sea levels, storm surges, and saltwater contamination of their water and food supply. They had no choice but to move inland. And that resulted in older persons, women, and children being cut off from the ocean that not only nourishes them, but is at the heart of their culture. In Portugal, I met survivors of the terrible wildfires who are still struggling with post-traumatic stress disorder. In Chile, I met people from communities who, because of a multi-year drought exacerbated by climate change, have literally no water in their homes, no water in their schools. And most recently, I was in Botswana, where I traveled to an indigenous community in the Kalahari Desert, where the heat is becoming absolutely unbearable. And climate change is making water scarcity worse. It's exacerbating human-wildlife conflict with elephants eating the people's crops, and it's affecting food insecurity as well. And in Kuke, a small indigenous village in northern Botswana, I saw a huge lineup of women and girls in the midday sun waiting at one of 2 standpipes serving a community of 1,300 people, waiting to fill containers of water that they had to carry back to their homes. And so, as I said, this climate crisis is a health and human rights crisis. Now, fortunately today I have the opportunity to have a second intervention because the news is not all bad. You know, the fact is that the climate crisis is affecting the rights to life, health, food, water, the rights of the child, cultural rights, and also the right to a clean, healthy, and sustainable environment, a right that was just recognized last July by the UN General Assembly. And so in my second intervention, I'll tell you about the hope that the right to a healthy environment and a rights-based approach brings, because I believe that a rights-based approach and the benefits of focusing on health can accelerate our movement towards climate solutions. Thank you very much.
Thank you so much, David. You will hear more, as he says. Let me now invite 3 ministers. They will share with us fantastic experiences. His Excellency Minister of Health of Yemen, please join the stage. Minister, I was looking for you to indicate me. Thank you so much, sir. Her Excellency Minister of Health Somalia. Yes, thank you very much. And His Excellency Minister, Pakistan. Thank you very much. Thank you so much. What a pleasure to have you all here. Minister of Health Yemen, you want to start? We have some personal stories to share here, things that are happening in your country. You want to start?
Yes, thank you, Maria. Actually, I have one story that happened 2 months ago. We are facing Hurricane Tig in our eastern coast, and that was type of the climate changes that affect the health. It comes sudden, and it was affect many of our health institute and health facilities. But the good point that we are, as we start more focus on the climate change, we put plan to respond to prevalence and how to respond to this hurricane especially it affect one of our beautiful island, Socotra, in the Arabian Sea, and I invite many of you to visit it. This island, it was isolated from all connection to the country, and it was isolated by this hurricane, and also the eastern coast. But when we are ready and we start supply before the start of hurricane, many fuel and drugs and health staff to these islands, we minimize the damage effect on these facilities. And unfortunately, we have about 6 people dead and more than 500 injured. But we think the response limits the damage, which can be more if there is no prevalence, and we start to plan how to aware people. We should stay in safe places, ambulance be ready. So this story gives us how we should ready for these climate change that affect the health facilities. And from our side now, it is just we start how to invest more, even from the local or more with our partnership, how we invest more on the infrastructure and on the health facility to be ready to any climate change that can affect the health facilities. Thank you.
Thank you very much, Minister. Very relevant. And to visualize a little bit more that, and to put some images here, can I have the second video, Luis? It will be showing a climate-friendly hospital. This is about a video that has been done in collaboration, and we want to show you this. If we can have the images, I think you will appreciate.
شحات بالمياه، وكان يعني الماء ياتينا احنا احيانا ب6 شهور ب7 شهور، مما اضطريت الى شراء 2 حمير لإيتاج الماء من مسافه تقريبا حوالي 15 كيلو الى 20 كيلو.
كان في يعني أزمة قوية جدا جدا جدا، كان بسبب انقطاع الديزل نهائيا، وتارة في ارتفاع الديزل إلى أسعار عالية.
المياه كانت ملوثة وما انتشر الأمراض، ولحد الآن نعاني بسبب هذه المياه، وجود أمراض لحد هذه الفترة.
بدأت مشروع الطاقة البديلة لإبادة الديزل، مشروع الطاقة الشمسية. طبعا استفدنا من الطاقة الشمسية بشكل كبير جدا بدل الديزل.
تم تدريبنا على تشغيل المنظومة والصيانة الدورية وعلى إجراءات السلامة المتعلقة بها.
لا والله تغير بعد وصول الطاقة الشمسية، يعني حسينا بتحسن كبير جدا جدا جدا. الحمد لله يعني الماء متوفر حتى لداخل المنازل، المطبخ والحمام. الآن سهولة ما كانت موجودة معنا من قبل.
انتهت المعاناة التي عشناها في الحصول على المياه.
Beautiful, no? I think it illustrates so well the power of solar. In this case, it was to clean water, but this was funded by the World Bank and implemented by UNOPS, correct? And this is a very nice display, very nice, what the minister has described as well. Can I now move to His Excellency Minister of Health of Somalia? Your country has been very much hit by climate change. Can you share with us what it has done to your population and how climate change is affecting you and what are you doing?
Thank you. Thank you very much for inviting me in this important panel discussion. I think when discussing most impactful intervention is to address climate resilience in Somalia, the climate change impact in Somalia is not something in the future, but it is something happening and happening now in Somalia. Now there is El Nino crisis and severe rainfall and severe floods affected most of the cities in Somalia, caused internal displacement of more than 2 million yearly. Before a couple of months, we were also suffering the effect of droughts resulted from 5 successive rainfalls failed. That also affected displacement, that also caused a displacement of more than 1 million internally. So Somalia is fluctuating between drought and floods that resulted from climate change. Now the country is in emergency due to El Nino situation. A lot of people displaced from their homes. There is some reports from some area indicating spread of watery diarrhea and cholera in some cities. It is crucial to recognize the unique challenges faced by our country due to its geographical location and vulnerability to climate change. In addition to that, the enhancement for building location and vulnerability to climate change, the enhancement for building the capacity and effectiveness of early warning systems is critical for timely response to climate-related health crisis. Adaptive infrastructure also is important. Investing in climate-resilient health infrastructure is essential to ensure the continuity of the health services during and after climate-related disasters. There are also critical interventions planned for Somalia, including strengthening health system resilience, building climate-resilient communities, and climate-resilient health facilities by providing solar generated electrification to health facilities. We have now installed solar energy system for about 7 regional hospitals and 16 district hospitals in the country. And now we are planning to expand to the other 13 regional hospitals and rest of the districts. We have installed also oxygen implanted solar system in some regions. We are also strengthening our capacity to climate-sensitive health interventions, integrating climate and health data, and mobilizing resources and international cooperation. So we are trying our best, but there is a need for coordination, cooperation internationally. The only Somali government cannot face all these challenges resulted from the climate change, that our country has less damage to the climate change. We are only the victims of what others made in our environment. So we hope that we all can cooperate to face these challenges resulted from the climate change. Thank you.
Thank you very much, Minister, and you are absolutely right. Those who are not contributing are the ones that are most affected and are the most vulnerable. Dear Minister from Pakistan, you were very good yesterday on your intervention, very powerful, but I think we are all still remember the terrible images we saw about the floods in your country last year. I suppose the question is, how are you coping with that? How are you preparing and responding to this dramatic thing? And whether you have the capacity to do something more climate resilient and low carbon healthcare facilities. Over to you, please.
Thank you very much, Excellencies. Ladies and gentlemen, good afternoon. I would present the Pakistan story. A population of 247 million, emitting less than 1% carbon, yet disproportionately affected by the climate change aftermath and devastation. We are ranked 8th on the vulnerability assessment of climate change devastation. The classic example was the 2022 floods, where we lost thousands of lives, 33 million people were displaced, thousands of health facilities, schools were damaged, crops were damaged, lands were damaged, and that incurred a total economical cost of 30 billion USD to us. Besides that, we are losing 22,000 unnecessary adult deaths due to air pollution annually, and 52,000 children deaths due to unhygienic water and sanitation. Now, when this is the situation, what we are doing? We have developed a climate adaptation plan and has been approved. Now, we are focusing on climate and health, and for that a scoping study we have conducted. We have developed a framework of action on climate resilient health system with the cooperation of FCDO. Now we are conducting a research study on the climate health vulnerability assessment and technological needs assessment that will feed into a climate health adaptation plan which will be developed next year and will be approved. We have started solarizing our health facilities, and we are moving from the fossil-based energy to solar energy. 500 health facilities will be solarized in 1 year, but this is still one piece of the equation. We need to do more. Apart from that, we are also working on training our community level health workers who are reaching each and every household how to first of all save themselves from climate health devastation, and also then orient and train people of the community so how best they can protect their lives and themselves from the climate devastation. We have high hopes attached with ATACH for 3 reasons. 1, for coordination, 2, for resource generation, and 3, for monitoring. And Pakistan volunteers to be hosting the annual meeting of ATACH in Pakistan. So the offer is from us and the ball is in your court. Going forward, we would like ATACH to advocate on behalf of those countries who are disproportionately affected, not for their sins, and pump resources adequately to their systems where there is a will, where there is a determination, where there is a vision. Well, we would like everyone to read our story from the lens of climate justice and equity. I thank you all.
Thank you so much. Again, very, very powerful and a very call for action to all of us to concentrate on those countries that are suffering the most. We will take the ball, Minister. Trust me. Let me go back to you, Jorge. Jorge, you heard the three examples of the three ministers. It's clear that we have to operationalize a lot. We need to do climate proof. We need to support those countries. So what international organizations like UNOPS can do to support the calls from those very vulnerable and affected countries?
Thank you, Maria. I think that the examples that were shared and the stories that were shared by the honorable ministers are indeed going to the point. That is, we need, if we want to build resilience, and to build resilience in the health systems, and to make the health systems contributing to sustainability, we need future-proof solutions, but locally driven solutions. Because each case is a different case, as we have heard. So I think that the principle must be building resilience and sustainability must be rooted on the aid effectiveness principles, on country ownership, on localization, on mutual accountability, on results-based management. And I think that this is a key element. The projects that have worked, it's because they were owned, led, originated by the countries. The second thing is internalizing all the externalities. If we want to be serious about resilience and sustainability, we have to factor in the projects all the externalities, not only the environmental externalities, but also the energy security externalities. For instance, when we take a decision to power an hospital with solar energy, this is fundamental, not just from an energy point of view, from a decarbonization point of view, but also from an energy security point of view. But also relying on local economies, on local contractors, on the local expertise. For an agency like UNOPS, almost 60% of all the procurement is being, and we are, as you know, Maria, we are one of the largest UN agencies on procurement. 60% of all the procurement is being provided by local companies. The same way when it comes to contractors. Every time I go visiting a project in Bangladesh or in Yemen or in Somalia, I see that the project is being developed by local contractors. The other element that I want to bring, if I may, it's about capacity. We are discussing the climate gaps, so the finance, the policy, the same with SDGs. And I don't think it will be possible to narrow the financing gap and the policy gap if we miss our capacity to narrow the third gap, that is the capacity gap, the implementation gap. And this must bring technical assistance to the core. I know that those of us that have been working on development for so many years, we got used to discuss technical assistance. But this element has been suddenly either overlooked or at least taken for granted. And let's make no mistake. In some cases, the finance is there, the reforms from the governments are creating the enabling context, but we are missing the third element, that is the capacity for implementation. And it's where, I end with that, it's where an organization like UNOPS can help. Because as we are doing technical assistance and operations in support of the government and benefiting from the local capacity, we can help to narrow this capacity gap. Thank you.
Thank you, Jorge. David, tell us how we join forces here. How do you see the role of the human rights approach on supporting this ATACH? I mean, this idea of having sustainable, climate-resilient healthcare facilities and improving access to clean sources of energy. I'm sure you have plenty of ideas. Over to you, David.
Thank you very much, Maria. And I'll try and deliver on the promise I made earlier about providing a message of optimism. But first I have to say, it's been 31 years since nations agreed on the UN Framework Convention on Climate Change, and yet greenhouse gas emissions have risen by over 65% globally. And one of the key reasons for that is that the UN Framework Convention and the Paris Agreement have no accountability or enforcement mechanisms. And that's why I'm so excited about the power of human rights, because human rights law, human rights institutions, and human rights processes can provide those missing pieces of accountability and enforcement. The right to a clean, healthy, and sustainable environment recognized by the UN last year is already recognized in the domestic legal systems of 161 countries around the world. The right to a healthy environment includes clean air, safe and sufficient water, healthy and sustainably produced food, non-toxic environments where people can live, work, learn, and play, healthy ecosystems and biodiversity, and critically, it includes a safe, stable climate. And the human rights-based approach to the climate crisis is so valuable because it clarifies the obligations of governments and the responsibilities of businesses. It focuses our attention on people in situations of vulnerability and marginalization. It is a catalyst for action, and it compels governments to provide people with the information they need, the opportunity to participate in decision-making, and access to justice when their rights are being threatened or violated. And over the past 5 years, we have seen an extraordinary growth of people using their human rights to hold their governments accountable for climate action. In Belgium, Germany, France, and the Netherlands, courts have ordered governments to accelerate ambitious greenhouse gas reductions of 55 to 65%. In Mexico, Brazil, and Colombia, because of cases brought based on the right to a healthy environment, courts have ordered governments to end deforestation. So this is a tremendously positive trend that we are seeing, and it's because people have the right to a healthy environment. And when it comes, there's one other thing I want to mention, which is the issue of money. As some of my colleagues have mentioned, the climate crisis has been caused by the wealthy, high-emitting states of the global north. It is the wealthy, high-emitting states that must take the lead, not only in reducing emissions, but in providing the levels of climate finance that are sufficient to assist with mitigation, adaptation, and addressing loss and damage in the global south. Here at COP28, there's been a great foofara about the fact that the Loss and Damage Fund is finally, after 31 years, in existence. But the wealthy states have been throwing pennies in the jar. We need hundreds of billions of dollars a year to finance loss and damage. We have the minister from Pakistan here, $30 billion in one episode in 1 year, and we're talking about governments like the United States putting $17 million into the Loss and Damage Fund. That is shameful, and it's, thank you. It's simply not consistent with their human rights obligations. We have to apply a fundamental principle which everyone agrees upon, which is that polluters should pay for their damages. And if we put a carbon tax of just $30 per ton on fossil fuel-related carbon emissions, that would raise over $1 trillion a year. So where does the money come from? It should come from the polluters. Some of that money should go to low-income households to cushion the blow of higher energy costs, but it would still leave more than enough money to pay for loss and damages. So we have the capacity, and I think that this combination of health and human rights is a very powerful response to the climate crisis. Last thing I'll say, I come from a small community on the west coast of Canada. 3 years ago, we put solar panels on the roofs of our medical clinic, and it's working like a charm, even in Canada. So I think every hospital, every medical clinic should have solar panels.
Thank you, David. I agree. If he works in Canada, he can work everywhere. So let's go for it. And I love this thing that together, health and the human rights, nobody will stop us. We will move mountains. We are here to move mountains, and I think we will do it. I have now a panel questions from the audience. My panelists, you want to stay here, you want to go down, feel free, but decide. You stay, you go?
Stay.
What do you prefer? You stay with me. Good. Yes, fantastic. I don't feel alone then. Very good. Then this first panel is closed. I think you got it, even if they are not moving. And now we will be moving some interventions from the floor, but you can, if you want to use a microphone, or you can go to the podium as you prefer. Feel comfortable. Luis, there will be microphones distributed? Yes, here we are. So in that case, can I start with you, dear. I have UNFPA, and I'm sure that as one of the in collaboration for this day, you want to say something. Julita, please. She's the director of the technical division of UNFPA.
It's a pleasure. Thank you, Maria. And really, as a member of the Alliance for Transformative Action on Climate and Health, I did want to just congratulate the panel. I think the solidarity in terms of what we're doing is one that UNFPA appreciates. For us, UNFPA is indeed the United Nations Population Fund. I would like the panel to, and the audience, to just, in the conversation we've heard, to just reflect on mothers, to reflect on sisters, and to reflect on daughters. Because I do think unless you reflect from a gender perspective on these issues, we miss just lumping everything together. And so for UNFPA, climate adaptation and resilience building is urgent for women, for girls, and for young people. And indeed, the impact of climate on this population group is really significant. We see it over and over again, and as I was listening to all of you talk, I just kept on thinking, let me bring a perspective that sometimes we lose. The first is, and I will take just water, the solar panels that we've been talking about, and drought, and just play it back from the perspective of sexual and reproductive health and rights. First, and I know it'll make uncomfortable some of you, women and people menstruate. Can you imagine menstruating every month where you don't have water because of issues of climate? And so it really is important, again, as we think about that, as we made available water and portable water, that it gives dignity to women who are menstruating. The second is around family planning, contraceptives. When we have disruptions in that system, again, women unintendedly get pregnant. When they get to a health facility with an unintended pregnancy, or even try to seek antenatal care, and they go to a facility that doesn't have water, can you imagine then how do they deliver? If they don't go to a place, heat stress, and they get there, no ventilation. You spoke, David, about comfort of air conditioning. There's no one labor ward that I've been to that has ventilation in the countries that we're looking at. So the outcome of pregnancy and childbirth is affected. And finally, violence on women. Because indeed, the woman from, I believe, the video we saw that was carrying water on her head, she is prone, and in many parts of the workplaces that we work, they're prone just by going out to fetch water in terms of violence. So these are the impacts, and I think it's really important then as we look at adaptation and mitigation and national determinant contributions, how well we're doing on that. And UNFPA had a study, and I'll end very soon, where we looked at 119 countries and how well their national determinant contributions integrated not only health or issues of gender and youth, but specifically sexual and reproductive health. And only a third of them did. And some of them are here, so we congratulate them. But we really need more action. And so as we look at that, we really need to see how better can we work in incorporating issues of women's health and specifically their sexual and reproductive health into national determinant. And that's what UNFPA brings to this partnership. And so really just wanted to put that out there for us, that indeed climate-resistant health systems must deliver essential health care for women and sexual and reproductive health that's life-saving. I thank you.
Thank you, Julita. Thank you so much. This was really very powerful. UNFPA, Julita Onabanjo. FAO, I'm sure that our colleagues from FAO want as well to join us. And we have with us Nancy Aburto, Deputy Director. Nancy, please.
Thank you, Maria, and thank you everyone for joining today. I was given a task to reflect on the panel in 1 to 2 minutes, so you can imagine how difficult that is. I am Nancy Aborta. I come from the Food and Agriculture Organization, and I'm also here talking on behalf of the 5th working group of ATACH, and that's the Initiative on Climate Action and Nutrition. But let me just reflect quickly on what the panel said. I heard from the panel an amazing sense of urgency. It's not a future problem, it's a today problem, and I appreciate that very much, ministers. And I heard that the climate crisis is a health crisis. We heard about malaria, we heard about the link to mental health, which is very important. We heard, of course, about waterborne diseases, and we heard about malnutrition. And all of these are indeed interlinked. But as David said, I'm going to be optimistic because I also heard that we can have integrated actions for response. We need to have context-specific actions, and we need to have actions that are based on our specific needs in specific areas, and we have collaboration and partnership with the UN agencies and member states that are ready to help make those context-specific actions appropriate for the challenge. And so the ICANN, the 5th working group of ATACH, we're so pleased to be part of ATACH because we can't have good health without good nutrition. So we feel like we're really bringing something to the table to help support strong health. But also nutrition solutions are climate solutions. And so back to the optimism, as we work together to ensure that we're getting good nutrition, we can at the same time be helping countries to achieve their goals related to climate action. And a few very specific are reflected in what we just heard. If we can have gender-inclusive and gender-responsive actions to our climate crisis, we are at the same time supporting good nutrition and good health. So I really just want to second the previous remarks. And with that, I want to thank again the opportunity and say anyone that's interested in that 5th working group, the ICANN, the Integrated Action for Climate and Nutrition, we are so pleased to work with anyone that is interested in finding ways that we can support achieving SDG 2 and SDG 13 simultaneously. Thank you.
Thank you, Nancy. Thank you. Very passionate, and clearly this call for joining ICANN and ATACH are critically important if we want to talk about health. Obviously, nutrition cannot be part of this critical agenda. My pleasure now to give the floor to the Selco Foundation. Haris Hande, the CEO. Haris, you arrived just on time. I saw you coming in. Please, tell us what is about these climate-resilient healthcare facilities.
No, thank you. Before
I'm sure you know something about it.
I'm not sure about that, Maria. Thanks for inviting me. And then while I was walking over, I knew you would ask this question. So I think the primary crisis that I saw is the laptop crisis. Like, in a sense, most of the people are on laptops. I don't know why have they come to COP at all in the first manner, right? So if they're replying to somebody else and then they go back and reply, so you come to COP. Meet people, right? It's like, no, but the question is, I'm asking everybody here, you're on the phone or a laptop. For what you do is, when you're about to send an extremely critical email, if you don't send it, you might lose your job, you might not have a next meeting, or Mr. Biden cancels your meeting. Shut it off. Shut it off. Open it after 10 minutes. The world still exists. For many of the children in the world, it does not. Many of the little ones, it does not. For those 10 minutes, when a baby warmer does not work, the world no longer exists. So whatever we do, irrespective how critical we think we do, I'm sorry, it's not even 0.00001% of that criticality. And we are not able to solve that criticality. And that does not require enough, with WHO, IKEA Foundation and Selco, we've done with a small program of doing 25,000 health clinics in India, solar power, which costs around $100 million, right? To do Somalia, it costs $100 million. To do Sierra Leone, it costs $15 million, with thousands of babies, and we don't have that money? I'm sorry, I'm on a question, if all of us stopped our laptops for 10 minutes, we would raise that money. 15 minutes, we would raise that money so that thousands of children would be there. So I think it's high time that we are able to, as with Maria Salvatore and Dr. Tedros, we promised that by 2028, are we able to make sure that at least for lack of energy, this world does not have to lose another little one. Right? Technology exists. Everything exists. Do you know one thing that does not exist? Is willpower. Unfortunate, right? Willpower, we can talk that's why I'm saying that the tweeting and the Facebook and everything, what are we doing sitting here? And so with WHO and UNICEF, we have a experiential maternal labor room in B2 where you can come inside. It's a 3D, 4D vision of how a baby is delivered without electricity and with electricity. And I'm 100% sure, Maria, if all of us and all of us here sat together for 2 days, we should be able to raise that resources to electrify so that no other little one is lost. Thank you so much, Maria.
Thank you so much. And I strongly invite all of you to go and visit that clinic. The horrible thing there is that when I was a medical doctor years ago and working in Latin America and in Africa, those were the conditions. No electricity, having a kerosene lamp to take care of a woman delivering at 3 o'clock in the morning, painful. The horrible thing is that even today in 2023, the situation is the same. Come on, absolutely unacceptable. And as you say that now the technology is not an excuse. If only we could take all the subsidies that are going to fossil fuels, we could solve the problem of everybody with the solar panel. Yes, we are together on this. Human rights and health, we will be unstoppable. Of course, nutrition and all of that. All of us together, we will be unstoppable. So let me now call on another very important partner here, Gaby. And I'm very pleased to have Ana Maria Bejar. She's the Director of the Public Health Policy Engagement. Ana Maria, you want to talk from the, yeah.
I'll just speak from here. Thank you very much, Maria, and thank you, everybody. Gavi, the Vaccine Alliance, is a public-private partnership. We work with core partners like WHO and UNICEF to provide vaccines to places where there were no vaccines before. So the first thing I want to say is that I support the statements that have been done on gender. So we have vaccinated 1 billion children since we were created. But as you know, babies don't go to get vaccinated themselves. The moms take them. And the moms possibly are the most affected by climate events. And if you think about a health facility, you will see a lot of women working as health providers. In the world, 70% of the health care providers are women. And only 25% are in leadership positions. So this is a beautiful panel, but we would like more women next time. So I just wanted to say that before. 3 points. One a very important point, which is something to be optimistic about, is that there are vaccines for some climate-sensitive diseases. So Gavi provides vaccines for cholera, typhoid, now malaria, and now we're thinking about dengue. So we provide for 6 climate-sensitive diseases, and we are now thinking about including in our strategy a climate angle that allows us to select vaccines for Shigella and dengue in the vaccine investment strategy. So the first call is please take and invest in routine immunization as a very important adaptation strategy. The second is that the beauty of ATACH, that is bringing us together, but we need to work in that intersectoral basis at every level, from the community level, at the global level. So let's continue creating health resilience beyond the health system. We need all the sectors to come together. And finally, really investing in mitigation as well. I mean, there are very important solutions, and thank you for the person who spoke from CELCO. I'm very proud that we are partnering with WHO and UNICEF, providing now, for 4 countries, solarization of health facilities. So Gavi has evolved from solarizing only fridges to think about, multi-sectorally and thinking the health facility itself as a whole needs to be solarized. So let's continue doing that and bringing the production closer to the people that need the goods to be healthy and happy. Thank you very much.
Thank you, Ana Maria. Muchas gracias. And I heard you saying before there is no vaccine against climate change, unfortunately. The best vaccine against climate change will be our brain, but I'm afraid we are not using it properly. So let's try to create some intelligence, and maybe then we will have a vaccine, the vaccine we need to, against climate change. UNICEF, our friends from UNICEF. Avi, we have Dr. Avi Solomon, Global Program Lead, Healthy Environments for Healthy Children. Avi, please.
Thank you, Maria, and thank you to all of the panelists and the excellent comments that have come from the floor. I think when you're coming in towards the end, there's very little left to say because it's all been said. But I would just say that we recognize at the heart of the climate crisis is a health crisis. In UNICEF, at the heart of the climate crisis is a child health crisis. That's how we see things. Because when you look at air pollution, it is 1,000 newborns that would die every day because of air pollution attributable deaths. And I think that's something, a statistic to remember, because you don't want, of course, household air pollution, you don't want ambient air pollution, but you don't want mishandling of medical waste in a healthcare facility and what that would mean. Heat stress is another one because children are particularly vulnerable. You have higher metabolism as children are growing, they sweat less. It's really important, the ventilation, when you're in a maternity ward, in a newborn care unit, what's needed, but also during the antenatal care part of it, and you don't want, so I'm just stressing some of the health care facility side of things also, because when we talk about climate resilience, we are talking about, of course, all of it according to the community, but health facility is an important part of it. And so therefore, the third thing we're really, really concerned about is an unsafe healthcare facility. Because when we say every child has a right to a healthy environment, which is the UN Committee on the Rights of the Child that has said in General Comment 26, that includes a healthcare facility. You can't go to a healthcare facility where there is no electricity, there is no water sanitation and hygiene, no waste management. And so you want healthcare facilities that are safe and green, where where deliveries can happen safely, where vaccines are safe and effective. And with all of the environmental challenges we see, we have thankfully the gift of vaccines, where we are able to save lives and protect children from deadly diseases, from tetanus, polio. I'm talking about some of those where environmental factors are a major contributor. If we didn't have vaccines, we would have had more children dying. But for everything, there isn't a vaccine. And that's the challenge with things like some of the things we see in air pollution, some of the things we see with heat stress, and some of the things we've got to handle as we deal with these issues. So I think one of the things we do want to say is that we do want to push this agenda of safe and green healthcare facilities that the member states are pushing for, together with our partners, WHO, CELCO, UNOPS, Gavi very closely, of course, and many others that are working in this space. And I'm really happy to see all of the momentum that's building towards healthcare facilities that have a lower carbon footprint, but it's more than a lower carbon footprint. It's about climate resilience. It's about life and death for a child. So I think that is something we really want to focus on. So just to talk very briefly about some of the things that UNICEF is focusing on, is that we have, in partnership with Gavi and WHO, have been moving in this space. We have provided solar power vaccine cold chain equipment, some 80,000 of them around the world, and that's been a big step. And together with Gavi, now we're going to the next step, and we move towards the entire healthcare facility. And I understand that we have done about 1,300 healthcare facilities to date. We want to move up to 2,300 healthcare facilities in the coming years to solarize them. But we've also been stepping up our work on the water wash in healthcare facility sites, which is in tens of thousands, and we want to, of course, upgrade that too. But more importantly, we want to bring solarization, waste management, wash in healthcare facilities, the basics of a healthcare facility that make it a facility. There is no facility if it doesn't have these basic services. Bring all of that together and make a healthcare facility something that provides like a healthy environment for a child to be delivered and vaccines to be safe. One of the other things we're doing is we're setting up a Children's Environmental Health Collaborative together with UNEP and the World Bank, and all partners are very welcome. And I think one of the things we're really trying to stress there is the unique vulnerability of children when we talk about all of the environmental issues that children face, including some of the brain development work that we were talking about a moment ago, where 1 in 3 children are poisoned by lead, which is another environmental issue that we've got to address. So we're building this together, and unsafe healthcare facilities is a spotlight risk we are going to be focusing on. Together with partners, we will be mobilizing more and more attention and action on this. Thank you so much.
Thank you, Sulaiman. Thank you very much. We have now, but I don't see him on the room, David Wineray from FCDO. David
was here, but I think
he was here, but I think he left, so we will escape that intervention. He's one of the critical supporters of ATACH. As you know, ATACH was born in Glasgow at the COP26, and FCDO UK government was the one putting it together, and if we are here today is to the support of UK. And then who took over was as well ministry in Egypt when they have the presidency in COP27. But let me, before giving it to my special guest, the many special guests we have today, gentlemen, can I propose you something? Can I sit in the middle?
Yes, please.
And can I invite another woman to sit here? I'm concerned about Twitter. People, Minister, please, can you take that, please?
Take my seat.
Yes, and that make this more dynamic. Juliet and Ana Maria, please, join me. Come on. Oh, no, I was not sending you out, but thank you very much. Yes, but I left my papers, which is... I am sure that this is not very much on the order that Luis wanted me to have. No, please, stay. No, I was not sending Jorge and David out. I was just inviting to have more diversity. But here you are. Please stay with us, please. Ana Maria, ven. Juliet, ahí está, perfect. I feel a little bit better now. Woman power. Thank you. Now we have a nice balance, I think. Very good. Thank you very much for that, and apologies for being so informal sometimes. I would like now to invite you if you have questions that you want to raise, and I saw my former colleague, Dr. Naema, you were raising your hand. Is something you want to say? Take a microphone. Thank you very much.
My name is Naim Al-Qasir. I am currently served WHO 26 years.
Very well. You served
yes.
Very, very
but
well. We are very proud.
But I am here listening to this, and especially taking it from rights perspective. If we go by dividing the human being, Excellencies, Ministers, I have the Minister of Health who have served lately, Dr. Khaled Abdel Ghaffar, in the room. And we have been talking about respect to the human rights and look at individuals from human rights perspective. What we have been doing, looking at the climate crisis, every entity takes the floor and talks about the very narrow of one, whether by age, whether by function, whether by gender, and this is for me critical. As a person who has been continuously calling for rights and the rights of a safe environment, I just take the philosophy of primary health care, safe water, safe nutrition, safety in terms of shelter, safety in movement, safe air, then I'm looking at human being. I think our climate crisis is because the way we have divided the human being into different portions. We forgot about disability totally today. We forgot about disabled who are having difficulties. We forgot about refugees and migrants. We talked about them differently. But if we talk about human beings, I'm looking at the human rights, then it's different angle. And I think it is time for us in the 75th anniversary of the human rights charter, and looking at the health and human rights and the health and the rights of the environment, then we will have a different mindset. Because we can go, where is our UNICEF colleague? We can go and children. The UNICEF said, refugee. So what we are doing, compartmentalizing a person, a full person, regardless of where they are. And this is one angle. The other angle, we talked about everything except how much the military and militarization that this region has suffered from is actually bringing the negative climate change angle. We are completely quiet about it. This is what we call politics. It's not politics. We are having children dying, newborn dying, because of the way we have handled how to bring the peace to the countries, the democracy to the countries. That's the rights angle. Again, we don't hear about it at all. We are silent. This region has been going on through one war, to one conflict, to one attacks, and heavy militaries are used. Wallahi, if we study the past 3 decades, 4 decades, the heavy military that has been used in this region, you will see what kind of negative impact we have done to our climate. I've served in Sudan, in Pakistan, I've worked in Somalia, I've served in Yemen in different capacities as consultant. I have seen the effect and impact of the climate change. So it's not I've not seen. But this is something we need to talk. The $100 million we are talking about, the solar. We can have solar, and I did it in Iraq the first time in 2004, in health facilities. We can have it, but then it can break. Attacks will happen. And that's the contribution that we need to look really as the resilient systems, resilient healthcare, protecting our planet, and I really would love that in COP29, we speak more in terms of this nexus angle and look at human being as a full person. I'm looking at the rights person, human rights angle, while we are talking about the 75th anniversary. Otherwise, we have been hearing, Maria, I have been with you for decades, and I have learned from you. The 2005 about green health facilities, healthy environmentally health facilities, hospital facilities. We try to do the walk the talk. But now it's the integration we are talking about, the system approach we are talking about, respects to human beings, and I will take the floor just 30 seconds to say, I lived for the last 3.5 years and before in Egypt served. That's the only country that I have seen no camps, no detention centers, and my humanitarian emergency colleagues would like to not to see the camps, people suffering in order to support, even the donors. Even my own colleagues at World Health Organization, Naima, what are you talking about? There are no camps. Yes, there are no camps, no detention centers, no concentration places for people. That's the model that we need to promote, and not to have the humanitarian support to give the environment and to give self-care and to establish health camps and to establish field hospitals. That's not going to be the solution. So I would like to bring this message. Thank you for giving me the opportunity. And I have been blessed to work with many good people like all of you here.
Thank you so much. Thank you. Thank you, Naima. There is a request from George Carlinger. Can you pass the microphone, please? Introduce yourself, George.
Good afternoon. My name is Josh Carliner. I am the Director of Global Partnerships for an NGO called Healthcare Without Harm. We were very involved with WHO and the UK COP presidency in the establishment of the COP26 health program, and we co-chair the Low Carbon Sustainable Healthcare Systems Working Group of ATACH. First of all, it is just such a beautiful thing to hear everybody talking about this issue in such a well-informed way, to listen to ministers yesterday expressing their commitment and their will to address this issue. 2 or 3 years. 3 years ago, I don't think we could have imagined that this would have happened. So it is an amazing moment, and it's important for us to celebrate that while also recognizing that we have a long way to go. One thing that struck me listening to the conversation, and I came in a little bit late, so maybe I missed this, but we're talking about solarizing health centers, but that's just one part of this. Solarizing health centers, addressing medical waste, addressing wash, that's one part of this. And I'm kind of going to channel Harish here, perhaps without all the charisma. But first of all, when we talk about solarizing health centers, we need to make sure that we are not creating a development disaster and debacle the way so many other development projects and initiatives have happened in the past. If a solar system breaks on a hospital and there's not the technical capacity to repair it or address it, it's going to end up as a ton of waste in the backyard of the hospital. And that can happen over and over and over again. So building the infrastructure, the human infrastructure and the physical infrastructure and the capacity to actually transform the energy systems of healthcare is going to take a concerted effort, and we need to learn from the mistakes that we've made in the past over and over and over again with different development initiatives. But secondly, again, solar is just one part of it. We need to build our hospitals and health centers with sustainable building materials, locally sourced. We need to make our hospitals and health centers anchors for the economy of the community by doing that. We need to make sure that our medical devices are super energy efficient. And this is something that, for instance, Pat has been working on. They've been doing challenges to begin to develop more and more energy efficient medical devices, because solar energy is not going to work as well if you're burning a lot of energy in the health facility. So we need to build energy efficient medical devices. We need to have standards for that. We need to transform how healthcare is provided. We need to use telemedicine in a way that serves the poor and marginalized populations around the world. That's part of our resilient health systems as well. So there's many more things. So I would just encourage people, as we think about this and we think about what ATACH is and what implementing climate resilient low carbon health systems might be, what it might look like, to think about solar as perhaps the poster child of this work, but just one part of a much more thoroughgoing and sophisticated effort that we need to build together. Thank you very much.
Thank you, Jos. I'm not supposed to intervene, but just a little detail. You says we should not be responsible for creating a humanitarian development disaster, but that development disaster is already occurring. Countries like Yemen can tell you how much they are spending on diesel to maintain an engine that is certainly non-sustainable. So what is happening now is already non-sustainable. They spend an incredible amount of money to pay for something that not only is contributing to the carbon footprint, is non-reliable, is very noisy, it's horrible to have that combustion. I work at many healthcare facilities with a diesel engine, and they are good for certain emergencies, but at the end of the day, this is the development disaster that we have created as well. Correct, Minister? I'm saying something. Are you spending a big amount of...
Yes, you are right. We spent about near to 35 with the budget of the government for fuel for carbon. So when you talk about solar to increase it, and it means a lot for us. And when it say it is not single, but actually when we are facing, Yemen after 9 years of conflict and disaster net, but actually now we only have 57 of the health facility is working. And of these, when we have solarization, especially in the health unit and health center, it means a lot for us. Because when this work, we reach to 57 of the health center because of the increase more on the solar. And actually, we solve a lot of problem for vaccination for Jaffe because we depend on solar refrigerator with solar. So even in rural area and mountain, as you say in the video, when we put refrigerator, solar refrigerator, it solves our problem. So it means solar, it means for us, especially in fragile and conflict country, it means a lot of things.
Yeah, and I agree with you, Josh, that is a holistic issue. Definitely, we all will love to have those hospitals that respond to all the needs, and solar could be one of the solutions, but obviously having all the medical devices, energy efficient, harmonized, we are working on that as well, definitely. Yeah. I saw your hand there. Thank you. Can somebody give you the microphone? Please introduce yourself. Thank you.
Thank you very much, Maria, for this opportunity. Excellency, Minister, ladies and gentlemen. My name is Hong Nguyen. I work for International Livestock Research Institute under CGIAR. So I'm leading the program called One Health. So I want to bring a little bit another perspective here, because we talk too much about hospital and facility, etc., which is important. I agree with you. But I agree with Maria also that we need to address the health from a system approach. And my keyword is three things: agriculture, livestock, and One Health. I know that ATACH is an initiative. Our colleague already mentioned nutrition. If we want to have a good health, I think that nutrition is acting at a very nice interface between agriculture and health. We all understand that, and I'm very glad that this health and agriculture have been brought very nicely at the COP level. So we need to invest in agriculture to produce safe food and nutritious food for people. Now, bringing to agriculture, and we talked about climate change. We talked a lot about livestock, the impact of livestock on climate. And my point is very much that in the rich country, people have too much meat to eat. And that's why they want to reduce it, which is very fair. But this narrative should not affect the people in the global south, in Africa, for example. Excellency Minister, in Somalia, for example, I work in Kenya and many African and Southeast Asian countries, people don't have enough access to protein source. It's come from livestock. So I think that we need to keep this balance for developing countries. And now the last point I want to make is about One Health. Maria is a quadripartite, including FAO, WHO, UNEP, and now WA, Joy, to develop this framework of One Health, stating the independence of health of our people, animal, and the environment. That's why we don't talk about three health, but we talked about One Health. And the COVID-19 has killed 7 million people, and that is zoonotic diseases. And for many countries, the livestock is important, but also we have wildlife. So how to prevent the next pandemic is about the task of everyone to work together to prevent the spillover and transmission of zoonotic disease from livestock or wildlife to human. So that's why I think that I would say that we need to look at health issue in a much more comprehensive approach. And also I like some of the statements from UNICEF, for example, to work on intersectoral collaboration and help people need to work also with people in agriculture, environment, so that we can achieve the health, and it's very much highly linked to the climate change context that we are talking here. So thank you very much for the opportunity.
Thank you very much. This part was supposed to be Q&A and not statements, but I see that people is very passionate, so let's go for it. Please, you have the floor.
Hi, Rawad Masood. I'm from private sector and working with hospitals on the carbon footprint. You've talked a lot about the hospitals and about scope 1 and scope 2 basically. However, the main carbon footprint from hospital is from scope 3, which is especially from the supply chain. How are you as ATACH, how are you going to affect this? And because you're talking about more than 72% of the carbon footprint coming from scope 3. Is there any, yeah, that's my question.
Should I take this question or ATACH? Okay, thank you very much for this question, very relevant. Yes, ATACH will be looking at that as well. We will be looking at decarbonizing the health system. And decarbonizing in principle is for middle and high-income countries, those who are contributing the most to the carbon footprint. But you're right, even in low-income countries, it's not that you decarbonize because they can't carbonize, but you need to be energy efficient in the way, for instance, you do waste management or the way you provide safe water. So definitely we have a group under ATACH looking at how to decarbonize. And there are 3 parts on that. One is supply chain, all the procurement, which is extremely important. The second one is healthcare. And the third one is about digital medicine, because that can save a lot as well in terms of the how you contribute to the carbon footprint. Of course, what we want is the best possible healthcare, and that's the priority, but at the same time, we want those that healthcare providers not contributing to the carbon footprint if it can be avoided. So I hope this answer. Thank you very much. I see another question in that end of the room. Thanks.
Thank you very much. That was a very insightful discussion and lots of great comments. I'm Dr. Shweta Raghavan, biomedical scientist. I'm from India. The question is very simple. So just to put this into context, we produce about 90,000 medical doctors per year in India from just modern medicine, and about 40,000 others from traditional medicines, medical sciences, right? Now these are your practitioners, these are people who are at the core of building all these systems we're talking about. I can guarantee you more than 75% of them are not sensitive to what's happening today in terms of climate change. Are there any publicly available tools or any programs where you could sensitize them? And this is not an easy task because we've just launched a program of AMR awareness in India. Somebody spoke about One Health. So AMR is antimicrobial resistance. And we've got new bugs coming up. So we started this last month. And we've trained about 16,500 people so far. It's been a very difficult task. You'd appreciate in just one country like India, there's about 17 or 18 languages. And for us to convert the nomenclature, it has been very difficult. And we are trying to resolve this. And there's so many countries around the world. So how are you doing this? Can this be more country specific? Because the people who are actually going to act upon this need to understand and have an ownership over the problem.
Thank you so much. You are talking at many of the UN system here, so I'm sure that publications is not a problem. We are desperate on publications. But you're right, we need to make sure that we reach the population. I saw Solomon, we wanted to say something. Yeah, this is one of the answers, Juliet.
Yes, and we also have one that we're working on, particularly in Bangladesh, with nurses and midwives, around how they understand and respond to some of what they are seeing in Bangladesh in terms of salination and how that impacts pregnant women. And so I think that's another area with young people as well as part of their own education in terms of sensitization about climate impacts and in reality what happens to them, and also their ability to engage in climate discussions. So I think as a UN system and family, we're all working at really empowering and giving sensitization to communities, to providers, and beyond that, letting them then take things forward. So good examples.
Yeah, thank you. If not, I think our special guest has been waiting there. And I say special guest for different reasons, not only because he's a great supporter of ATACH, he was the presidency of the COP27 in Sharm el-Sheikh that we all enjoyed very much, but he's a really strong advocate on climate change and health minister, and of course supporting this ATACH, of whom they are co-conveners with UK. So my great pleasure to welcome you, dear Minister of Health from Egypt. Do you want to come to the podium? Thank you very much.
Thank you so much, Maria, and I think you're doing a great job moving all around the COP. I hope you had a great time, and you're very valuable in moderating and as well as in your comments in relation to climate change and health. This is a very good discussions that I've been going through. I think excellent panel and very important, fruitful discussions and important deliberations coming out from this discussions. I believe that whatever we're seeing now, yesterday and today, is a historical moment when it comes to health, and I think we have all to work together from this day all the year long, so that we can build on what we achieved during this COP28, and I believe next year it's going to be in Australia, so that will be also another challenge. So to build on what achievements that we are going to have during this year. My great appreciation to the panel and my dear friends from Somalia, in Yemen and Pakistan, and from the UNOPS and the WHO and activists and international organizations, as well as Dr. Naima, she's still here. Great intervention, very passionate, and we really appreciate your work in Egypt and all over your career. I think you've done a great job along so many years, so thank you for that great help. I would like to express my gratitude to each of you and for your valuable contribution and insight through this engagement session. Today we have examined the critical importance of climate resilient health system in the face of challenges posed by climate change. We have explored the power of partnership and collaborative initiatives to drive transformative actions and create sustainable solutions for the health of our communities. And I like that you're talking about a human being, not just the communities, and not just a human being. As a matter of fact, if we consider One Health, then we have to consider the planet and the plant, the animals, and the environment as well. The initiative on climate action and nutrition that we work together with different partners serves as a beacon of hope and bridging the vital domains of climate change and nutrition. It recognizes that the impacts of climate change on food system are profound, affecting the availability, accessibility, and the nutritional value of our food. By addressing these challenges through collective action and cross-sectoral partnership, we can safeguard the health and the well-being of our population. Partnerships such as the Alliance for Transformative Action on Climate and Health play a crucial role in this endeavor. ATACH brings together diverse actors committed to advancing climate-resilient health system by promoting cross-sector collaboration, knowledge exchange, and policy advocacy. ATACH also has the potential to drive transformative change and accelerate the implementation of climate-resilient strategies within our healthcare systems. I would like to take this opportunity to highlight the success of the initiative on climate action and nutrition as part of ATACH, and the initiative was proudly launched under the leadership of COP27 Egyptian presidency, and in cooperation with WHO, the FAO, and the GAIN and the SUN. The initiative comes as a holistic platform bringing together governments, international organizations, civil society, researchers, and the private sector, which we can pool our resources, share knowledge, and amplify our impact. This multi-stakeholder approach enables us to address the complex challenges at the intersection of climate change, nutrition, and health, and forge a sustainable path forward. As we move forward, let us keep in mind that climate-resilient health systems are not only a responsibility, but also an opportunity. By integrating climate change consideration into health planning, we can enhance our capacity to respond to emergencies, mitigate the health risk associated with climate change, and certainly promote sustainable development. We can create a future where the health and the well-being of our communities are safeguarded and no one is left behind. In closing, I would like to express my gratitude to all the participants, speakers, panelists, and partners who have contributed to the success of this panel discussion. Your expertise, dedication, and commitment to the healthier and more sustainable future are truly commendable. Let us carry forward the momentum generated today and continue our collective effort to build a climate-resilient health systems. Together, we can make a difference. Together, we can create a future where the health of our planet and the well-being of our communities thrive in harmony. Thank you, and let's continue our journey towards a resilient and a sustainable future. And I thank you.
Thank you. Thank you so much, Minister. We have been very fortunate today to have very strong 4 ministers of health who I'm sure that they are very strong advocates for climate change and health, for solutions, because it's hope, as David, you say, let's provide hope as well. So, dear Minister of Health, Egypt, dear Minister of Health from Somalia, from Yemen, from Pakistan, thank you so much for your support. And of course, all the colleagues from all the UN organizations. Jorge, should I give you the floor to, I'm sure you will have some concluding remarks, and of course, as a co-host, you want to share. Sorry that I put you out of the panel, but...
You did very well. Thank you. No, I just want to, in 30 seconds, to thank and to underscore what is in the title, that is partnership. I think that from all the stories that we have learned today, not only the opportunities, but also the bottlenecks, partnership must be at the core. Nobody can address resilience and sustainability alone. This is a long shot, but we must take it with a sense of urgency. So we can only go further and faster if we go together. So thank you so much for joining forces today. We look forward to continue contributing to this. You can count on us from an operational point of view. Thank you.
And I understand that there is a picture, family picture, Luis? Yes? Okay, let's do it. Thank you so much, everyone. Thank you.